Days ago, the federal government declared a lockdown in Lagos Ogun and the FCT to contain the further spread of COVID-19. Today on the show, we take a look at how the country has fared in trying to flatten the curve in the last 2 weeks. I'm Olasumbo Modupe. Welcome to the show.
As the fight against COVID-19 pandemic continues in Nigeria, more than 80 patients have now been discharged. According to the NCDC, they were discharged after being treated and tested negative. Over 300 positive cases have been confirmed, while 10 deaths were recorded and more cases have been reported in these states. NCDC says 91% of all contacts of confirmed COVID-19 cases in Nigeria have been traced and are being followed up. As part of continued efforts to curtail the spread of coronavirus, there are plans to begin door-to-door active search in Lagos. Governor Babajide Sanwo-Olu said some health workers will be moving around in pairs to administer an electronic questionnaire at homes and healthcare facilities to make inquiries about some symptoms like cough, cold, and fever. The initiative is in a bid to intensify search for possible cases of COVID-19 in different communities across the state. Known as Active Case Search, officials can be identified with a COVID-19 outbreak response tag or a letter from the local government area. The state has also partnered with construction giant Julius Berger PLC to embark on the disinfection of some major roads across the state. 2 new labs have been activated for COVID-19 testing. Influenza Laboratory at Aminu Kano Teaching Hospital, Kano, and National Veterinary Research Institute, Plateau, bringing the number of COVID-19 testing labs in Nigeria to 11, while work is in progress in Maiduguri, Sokoto, Port Harcourt, and Kaduna. A total of 14,497 confirmed cases, 788 deaths, and 2,823 recovered from 53 African countries. As it stands now, about 2 million confirmed cases have been reported worldwide, with more than 400,000 recoveries and over 100,000 deaths. Members of the public are advised to stay at home, practice social distancing, observe the highest possible personal hygiene, and report suspicious cases by calling 08000 Corona or NCDC on 0800 97 000010.
It's still Soundhealth on Lagos Television. Today on this show, Dr. Ifeanyi Nsofor, a community health doctor, will review the ongoing efforts by the federal government to flatten the curve. Dr. Ifeanyi Nsofor is the Chief Executive Officer of EPIC Africa and the Director of Policy and Advocacy at the Nigeria Health Watch. Dr. Nsofor is also a thought leader in global health. Welcome to the show, Doctor.
Thank you so much for having me.
Okay, it's 2 weeks since the federal government declared a lockdown in Abuja, Ogun, and Lagos states to stop the further spread of COVID-19. What is your assessment of the situation?
Okay, so I think to me, first of all, to some extent, people have obeyed the lockdown. Businesses are working remotely, and to a large extent, although we've seen an increase in community transmission of COVID-19, at least based on the data coming out of Lagos, but also the cases have not, really gone up exponentially. However, despite some of these successes that have been recorded, I think there are also challenges with some people, maintaining the lockdown and not going out. There are cases from Lagos, especially, of the people that are jogging along, exercising along the highway, or the celebrity from Lagos that had a party and was eventually taken to court by the state government. But I think most important, the greatest impact really is on the economic well-being of the people, especially on small businesses that earn on a daily basis. I think that's probably the greatest challenge we're having with maintaining the lockdown across these 3 states that you mentioned.
Okay, you're based in Abuja. Would you say the assessment so far is comparable to that of Lagos and, let's say, Ogun states?
Well, I guess in Abuja it depends on where you are. If you're within the city center, it's virtually empty. If you go out, you hardly see cars on the way. But if you go to the suburbs, to some of the satellite towns around Abuja, where the bulk of the population live, then you still see people hanging around in groups and all. And obviously, some people trying to make a living, especially in the evening. So, in as much as in the city center, the highbrow areas, people seem to be adhering to it. It's several estates cut across the city. But once you go to those densely populated areas, there are still challenges with people adhering to the lockdown. And it's understandable because people are trying to make a living. But how do we get people to understand that the solution to our problem now, the solution to curtailing the community transmission of COVID-19 really lies in our hands? There's so much that government on its own can do without the people making sure that they adhere strictly to those recommendations by the Nigeria Center for Disease Control and state ministries of health.
Okay, from the 31st to now, the statistics grew from less than 100 to over 300. Are we making progress?
Yeah, absolutely. Remember that by the time the lockdown happened, the whole idea was we were sure that most of the cases at that point in time were imported, and those cases had mixed with people, in country. So the whole idea was for NCDC and partners to trace those people and trace their contacts. And people were sure that a number of those cases were imported, and it really made sense that as long as NCDC is able to trace everybody involved, the number of cases will go up. It just shows that the surveillance system is working. But the concern really is that we're beginning to see that some cases are actually out of community transmission. So they've gone beyond just those people that came in and their primary contact to other people that some of those contacts have also interacted with.
Okay.
So that is the part that should concern us really. But having the number of cases go up, it just shows that the surveillance system is working. But however, how do we ensure that it doesn't go up astronomically like other countries? Okay. Is really maintaining this lockdown and ensuring that people practice social distancing and other physical distancing and other recommendations by the Nigeria Center for Disease Control.
Okay, in Lagos, the epicenter, we've had a number of recoveries as well as reported cases of local transmission. What could be responsible for these updates?
Okay, so I think we need to give credit to Lagos State. Lagos State, through the executive, the governor, has shown a tremendous responsiveness to preparing for this particular epidemic and also responding to it as it happened. Because I think that is the level of preparedness of Lagos State that has just shown us why political will is very important. And let me explain why. Even before we had our index case in Lagos, in Nigeria, Lagos had already set up an incident management center, whose commander is the governor. So that's highest political will. And I can imagine that because of that, they are deploying every resource available. So the number of cases that are recovering, that is a good thing. And it also helps build confidence in the people that, see, if you get COVID-19, we don't want you to get it, but if by adventure you get it, it's not a death sentence, you could recover from it because data shows that people are recovering from it. So I really think that we need to give the Lagos State Governor and the Commissioner for Health credit for the way they've responded to this outbreak.
Okay. There have been lots of theories in the past few weeks about the pandemic. What is your take on, or what is your view, Dr. Nsofor, on the repeat outbreak decades ago? Many have said this outbreak or could be attributed to some that was experienced decades ago.
Sorry, I didn't get that. Attributed to what?
This particular pandemic has been attributed to an outbreak, a similar outbreak decades ago. What's your take on this?
Okay, so there have been several outbreaks, especially related to coronavirus. So the SARS epidemic, the MERS epidemic in the Middle East, they are all coronaviruses. But this is a new coronavirus, and I think that's part of the challenge with it really, because it's new. There's so much. We know so little about it.
Okay.
The global community is beginning to learn as we respond to the outbreak.
Okay.
So I think the only similarity between MERS and SARS is the fact that they are from the same large family, the coronaviruses. But this is a new one, and I think it's very important that we listen to the scientific community as we learn, and evidence begins to come out as to the best way to approach this.
Okay, now as a stakeholder, what is your take on the Chinese doctors invited by the federal government?
Okay, so I think first of all, Jack Ma, the Chinese billionaire, has donated some items to all African countries. My understanding is that the Chinese team is part of that. Is part of making sure that donation and some equipment they have given, to support the community here in Nigeria for training people how to use it.
Okay.
The FGF has sent out a memo that the Chinese doctors, the Chinese health professionals are not treating anybody locally.
Okay.
But having said that, I think in this kind of pandemic that affects every country in the world, we cannot afford to reject help from any country, especially help with good intention. Because let's not forget that this COVID-19 started in China. They've responded to it. They've managed to reverse, the epidemic within their country. Cities are beginning to open in China. So there are great lessons that we can learn from them. And I think that's what we should focus on really, and not whether, they are Chinese or, having all sorts of conspiracy theories. There's no need for that. Because the same Chinese government, the same China donated about 1,000 ventilators to the city of New York. But you don't see Americans crying foul over that. The whole idea is let's come together as a global community and make sure that we stamp out this pandemic. Because everybody's at risk as long as, a country still has some cases left.
Okay, Dr. Nsofor, how can we flatten the curve? We've had several submissions in the past weeks. For instance, the US recently released an information about the use of masks. We have the regular hand washing. How can we flatten the curve?
Okay, so like I said initially, at this point in time, the solution to this lies in everybody's hands. And so those basic public health advice that NCDC and state ministries of health have been passing out. Wash your hands with soap under running water. When you cough, cough into the angle of your elbow into tissue and dispose it and wash your hands. Don't touch your face repeatedly. Maintain social distancing. So those are the basic things that we ought to do in order to ensure that we stem this outbreak. However, I understand that in our own context, it's a bit challenging, because one, how many people even have running water at home? And part of what I tell people is that running water is not necessarily water coming out of a tap. As far as hand washing is concerned, running water is also somebody pouring water for you within your household so that you can wash your hands with soap. So that's one. Then secondly, when you look at how densely populated our cities are, over the years, there has been very poor urban planning across Nigeria. So how do you ensure that, for example, in households where you have face me, I face you, where people use the same toilet. You have like 2 or 3 families use the same toilet and bathroom. About 5 families share the same kitchen. How do you ensure that social distancing happens there? So those are some of the things I think we should begin to think about innovatively within our own context to ensure that to the best of our ability, people at least are able to do all those things all those public health advisory that NCDC and ministries of health are continuously putting out.
Okay. What should we expect days ahead?
Okay, so I think first of all, when you look at the 3 states you mentioned, Lagos, Ogun, and Abuja, have had a lockdown. We want to hear from the president. So what next? Officially, the lockdown ends today. Is the lockdown continuing or not? If it is continuing, for how long? Because I think it's very important for the president to clear that air, because people have been wondering. So you said 2 weeks. Today is the end of the 2 weeks. Should we now start going out or not? So we need that clarification from the government.
Okay.
But also, Nigeria is a deeply religious country. And I think that religious leaders have a very huge responsibility here. To ensure that they speak to their people in the same language, passing across the same messaging that is coming out from NCDC and state ministries of health about all those things we've talked about, hand washing and all. Okay. It's very important that community leaders, religious leaders, because these are the people that our people respect and revere. But having said that, how do we also begin to hold other arms of government responsible? So a lot of pressure is on the federal government. A lot of accountability is being pushed there. What about state government? What about local councils? Local councils are where people reside. Are we asking questions? What are the different local government chairmen doing? So I want to see local government councils sit up and begin to take responsibility for this, if not for any other thing, ensuring that the messaging about prevention is properly disseminated within their own locality. Okay. And also, they provide some kind of palliative for the poor people living within their community. We cannot only depend on the federal government, because Nigeria is a federation, and the different levels of government have their own responsibility as far as governance is concerned.
That has been Dr. Ifeanyi Nsofor, a community health doctor, on how to flatten the curve of COVID-19 in Nigeria. Dr. Nsofor is the Chief Executive Officer of EPI Africa and the Director of Policy and Advocacy at Nigeria Health Watch. Dr. Nsofor is also a thought leader in global health. Sound Health continues in a moment. Please stay with us. We say thank you on today's episode of Sound Health. Please ensure you take responsibility in playing your role in reducing the COVID-19 spread in the country. This is where we say thank you on today's episode of Sound Health. Ensure you take responsibility in playing your role in flattening the curve of COVID-19. For comments and inquiries, please send SMS to 0035826603 or follow us on social media at LTV Social, #SoundHealth. A sound health is a sound mind. Make healthy living your choice.